What do changing moles look like for basal cell carcinoma? Imagine noticing a new bump or spot on your skin that wasn't there before, or an existing mole that suddenly looks different. Basal cell carcinoma often doesn't start from typical moles but can sometimes develop from them or appear as new skin changes. If you see a shiny bump that looks like a small, smooth, translucent dome, it could be a sign. These bumps are often flesh-colored, pink, or white and might have tiny blood vessels visible on or around them. Sometimes they bleed easily or from a crust, especially if irritated. Another clue is if a mole or spot starts to grow larger or changes shape. It might become irregular or uneven, with edges that are not smooth. The color can also shift, ranging from light pink or flesh tone to darker shades like brown, black, or even blue. Sometimes dark spots appear within the lesion, or the border looks translucent or blurred. These changes happen gradually over time and should not be ignored. Flat, scaly patches are also common with basal cell carcinoma. These patches may look like dry, flaky skin or eczema but persist and slowly enlarge. They can be red, brown, or flesh-colored and might have a slightly raised edge. These patches often feel rough or scaly to the touch and don't go away on their own. Some basal cell carcinoma lesions resemble scars, with a waxy or shiny appearance. They may look like white or yellowish scars without a clear border. These areas can feel slightly depressed or smooth but are persistent and do not heal like normal skin wounds. Persistent sores or ulcers are another warning sign. If a spot turns into a sore that keeps bleeding, crusting, or failing to heal despite time, it could be a basal cell carcinoma. These sores might come and go but tend to stick around or get worse. Texture changes are also common. The affected area might become raised, tender, or itchy. Unlike benign moles, which usually stay the same, these changes in texture and appearance should prompt a visit to a healthcare professional. In summary, suspicious changes for basal cell carcinoma include shiny bumps, scaly patches, scar-like areas, persistent sores, and visible blood vessels. These lesions tend to grow slowly and are most often found on sun-exposed skin like the face, neck, or arms. Because many skin changes can look similar to benign conditions, it's important to see a healthcare provider if you notice any new or changing skin spots. Early diagnosis through a clinical exam and biopsy can lead to effective treatment and prevent further skin damage. Always remember, individual skin varies, and any concern should be evaluated by a medical professional for personalized advice.